Hello, my name is Dr. Sirisegaram. I'm here today to talk to you all about the role of sex in motor and cognitive trajectories before dementia. I did not do this work alone. I am part of the Gait and Brain Lab, which is an amazing lab here at Parkwood, and under the guidance of Dr. Montero-Odasso and Dr. Sarquis-Adamson. Okay, so the decline of motor and cognition in aging have been associated with future disability and mortality. And the coexistence of cognitive and motor decline is more prevalent in older adults who are at risk of developing dementia. Studies have shown that cognitive decline precedes dementia by several years, and motor decline can precede cognitive decline by more than a decade. A recent study done here at Parkwood highlights that older adults who showed dual decline in both motor and cognition are at increased risk of developing dementia. We call these folks dual decliners. Additionally, comorbidities with dementia have differences as well, specifically when it comes to sex. Cardiovascular, metabolic, blood pressure changes, and hormonal changes are all important factors that can really increase the risk of vascular dementia in males. Just going forward, the specific question of sex differences in these dual decliners has not yet been explored and may have vital clinical information in stratifying older adults for identifying factors unique to each sex that may be reversible to delay the progression of dementia. So the aim of our study was really to examine the role of sex in cognitive and motor trajectories before dementia. So how did we go about doing this? Essentially, data was used from the Gait and Brain Study, a prospective cohort study in a community-dwelling older adults free of dementia at baseline, based at a university hospital here in London, Ontario, Canada. Participants' motor and cognitive trajectories were assessed twice a year for 5 years using gait velocity and the MoCA test, respectively. We ascertained incident dementia using the DSM-5 criteria, and we ascertained the risk to progression of dementia using the Cox-regression models, stratifying by sex and adjusting by age and comorbidities. And now for the fun stuff. What did we find out? Well, from 207 older adults, 37 individuals, so approximately 18%, progressed to dementia, from which 43% were males and 57% were females. Among dual decliners, males had a higher risk for progressing to dementia when compared with females, as shown here. So the hazard ratio here is 3.9, with a p-value that's significant compared to females. In addition, in males, the association becomes stronger after adjusting for comorbidities, as seen here, with a hazard ratio of 4.36 and a significant p-value. In females, the risk of progressing to dementia lowers when adjusting for comorbidities, i.e. The hazard ratio was 1.4 and the p-value was not significant. What does this mean? Well, this suggests that the number of comorbidities might be driving the association with progression to dementia when comparing males who had a hazard ratio of 4 compared to females who had a hazard ratio of 1 in both adjusted and unadjusted models. And here is a table highlighting the results there, just to give you guys a glimpse into the actual hazard ratios and the p-values. So what does this mean in general? Well, in conclusion, males had a higher risk of progressing to dementia than when they had dual decline in comparison to their female counterparts. This tells us that older adults that present with both motor and cognitive decline, i.e. dual decliners, have the highest risk to progress to dementia, particularly if they are men. And when we look at the comorbidities, there may be an answer there to help us predict males who will progress to dementia. This study highlights the importance of sex differences in motor and cognitive decline and trajectories before dementia, and provides us with the clinical acumen of perhaps targeting both physical and cognitive interventions for males specifically who are undergoing decline. And here are my acknowledgements. Thank you so much for listening to me today.